I want us to start off with the NHI. I want us to kick off with that bill that you signed in Parliament, or not in Parliament.
At the
you
Union
signed it
Building.
At the Union Building.
The seat of government.
At the seat of government last week, Wednesday. It was passed by the National Assembly in around December, and it appears to me, and tell me if I'm wrong here, signing it several days before elections was probably a political move. Why did you wait since December to only sign it last week?
When the president is presented with a bill from the National Assembly or from Parliament, he has to apply his mind. And he has to also send it for verification, for scrutiny by the presidency staff and internal people, legal and otherwise. And that whole process is not a short process. So I don't receive a bill from Parliament and then sign it immediately thereafter, because I have a number of options. One of those is to send it back and say, no, you've skipped this and that and so forth. So once I had done that, I then signed it. Now, by the way, there are quite a number of other bills that I'm going to be signing in the next few days or so, because they've been going through a lot of processes. You might recall that Parliament went through a process of approving a number of bills in the recent period, in the past 6 months. And so that process then gets underway in the presidency. And this is not an election ploy, by the way. The NHI has been in the making for 81 years. 81 years. In 1943, the African claims said there should be universal health coverage. And in 1955, when the Freedom Charter was drafted, the same was said. And the United Nations has said in one of their Sustainable Development Goals that there needs to be universal health coverage. So we are implementing what has been in the making for many, many, many generations.
I think while the idea of universal healthcare is important and it's a just cause, there are questions about the timing. I think Clement has asked you about it. Yes, many months in the making, but it's also on the eve of an election. Mm-hmm. The opposition are saying it. South Africans are skeptical. Mm-hmm. What do you then say? In part because ANC leaders are also using this to campaign. We've heard Gauteng's premier candidate pretty much saying to supporters, tomorrow you can walk into any hospital. Mm-hmm. You will not die.
Yes.
And that suggests literally that tomorrow they can go to any hospital.
Well, the implementation of the NHI is a process. It's going to be phased. It's going to take a while to finally bed down exactly what the National Health Insurance will be all about. We needed to start somewhere. And this is where we have started, to implement what our forebears said should happen. So we implemented it. Now, it's not an election ploy. I mean, really, people are naive to think that people will now throng to the polls because there's NHI. There are many things that people give consideration to. Many, many things indeed. And, being able to go to a hospital or to a doctor is not one of those. But in any event, it is here. It is law now. I've signed it into law, and the implementation process commences.
But to be fair, Mr. President, I mean, as soon as you signed it on Wednesday, you didn't waste time. When you were in KZN, you spoke about the NHI and having been signed and the kind of difference it's going to make. Yes. I would like you to clarify to our listeners this morning, because there's an impression out there that after elections, we are going to immediately start seeing the full implementation of NHI. Can you clarify to our listeners that this is a phased approach that may take about 6, and if you're going to have court challenges, it could be even more? Yeah.
No, actually, to clarify it to your listeners clearly, I mean, the implementation of the NHI is going to commence. It's going to take time. It's going to be phased. Even the law itself does anticipate that and does speak to that when the NHI is fully implemented, certain things will happen. So the NHI implementation process is going to be phased. It's going to be a process. And you might want to recall that we started a few years ago to do test drives, if you like, of the NHI implementation. And a number of clinics, a number of hospitals, more clinics, I think, were chosen to be the test drive centers for the NHI. So this has been going on, and talking about it is actually saying one of the things that we have fulfilled this term of government is that we've signed the NHI. Like, for instance, we fulfilled the implementation of the national minimum wage during this season. And I've been talking about that. These are things that have been done. We have succeeded in bringing down the incidence of load shedding quite drastically in this term of government. So as a politician, I will talk about that. It is only those who are possibly against the NHI who will shout out. But the majority of people who are for the NHI, who see that the NHI is going to be of benefit, like our forebears in 1943, who foresaw that in 1955, will be applauding and saying, yes, finally, we have the NHI, and it's been done in this session or in this term of government. So for me, it's a no-brainer. It really is a no-brainer. People should now be saying, how will the NHI be implemented? That's what we should now be focusing on. And what did we learn from the test drive, if you like, once again, like for the real term, test-driven process? What did we learn from it? What can we improve? Are we going to improve our healthcare through NHI? That should be what the debate should be all about.
But at the same time, Mr. President, you have healthcare practitioners who are speaking out of concern. You've got technocrats who are also quite concerned about the way that it's moving around NHI. And then you have business that feels betrayed and left behind. Your response to those pockets who say, we want to come on board, we want to help.
Nothing that we do always satisfies everyone. I think that should be the starting point. Everything that anyone does, you'll find that there are people who agree with it, there are people who don't agree with it. Even in my own party, there are often decisions that are fully supported and other people will feel differently. So I live with that as a politician and as a president. I know that nearly every law that we pass, there will always be those who feel it should not have been passed. But we cannot hold back. We cannot hold back giving our people universal health coverage like the United Nations has said. Because, yes, there are people who say, no, but you should have put this I here and dotted this T here and so forth. You cannot hold back. The whole process, it has to continue. And their concerns, yes, can be addressed as we move on, because even the NHS in the UK, when it was introduced, it was not perfect. It was not perfect, and they've kept on revamping it and improving it as they have gone on. But after the war in 1945, they had to introduce the NHS, and it has been reviewed over time. And similarly, like us, we cannot stop, the progress of health coverage history. Because, yes, this one has a problem with that, this one has a problem with that. The majority of people do. And by the way, the NHI was voted by the elected representatives of the people of South Africa who are in parliament. And they, in their majority, voted for it. And that is how we pass laws. And when we pass laws, we take the representations of people into account, and thereafter the representatives duly elected are the ones who then decide on it.
I want to take you very quickly a step backwards as well. Clement asked you about explaining this to our listeners.
Yes.
I want to take you a step back and ask you to speak of the deficit that continues to exist between government and the people you serve. Because part of the difficulty around the NHI is the belief that you lead a government that is actually capable of delivering this, rightfully so, and we won't hear of corruption. I'll always take you back to a conversation I had with you in 2020, where I questioned about the possibility of COVID corruption. You said it wouldn't happen. We had a conversation the following year, following widespread looting and PPE corruption. What says you now in 2024?
Well, you see, we've learned a lot of lessons over time, and particularly also about dealing with incidents of corruption. And I'm the first to concede that when we came to the PPEs and personal protection equipment, we made a mistake. We allowed everyone in the country to be a provider, a supplier, and a procurer. And yet with the vaccines, we centralized everything. Because we were facing a national calamity, we should have done that with the PPEs as well, because then we would have reduced the incidence of corruption. We made a mistake. I will concede that. But when it came to vaccines, we centralized everything, and there was just literally no corruption, or if at all, it was very isolated. So this time round, and we've learned lessons. We've learned lessons when we instituted the SRD, the 350, if you like, for lack of the right word now. We had incidents of corruption of civil servants who registered, who are employed by the civil service, who registered and also got the 350. And we immediately clamped down on that. And we now have a grant system that is working well. Many other things do work well, and people lose focus on that. For instance, the monthly pensions that we pay to our old people, they work very well. The child grants, they work extremely well.
Except sometimes there are glitches.
There are glitches, as everything in life will always have glitches, but they do work well. And incidents of corruption is something that you curb as you learn. You learn on the job, as it were, and as you learn, you then close the loopholes, because people who want to steal will always find loopholes, and that is when, as they happen, you close those loopholes.
As we wrap up on the NHI, Mr. President, how is it going to be funded? I know the Health Department has previously said it expects to raise about an additional 200 billion rand or so for NHI with taxes. But can South Africans be taxed higher than they are now with all the financial pressure under them? I mean, there's so many South Africans who, for lack of a better phrase, are double taxed. They feel, government, you fail to provide reliable reliable security, so they get private security. You fail to provide quality education, they take their kids to private schools. They feel you fail to provide public health, that's why there's private hospitals and private doctors. So, one, how is it going to be funded? And two, is this an admission through the NHI as government that you actually admit that you failed in managing and offering quality public health care in the public hospitals? That's why now you want to piggyback on the private sector.
Clement, the people who said there should be universal coverage in 1943 were not mad. And the people who said in 1955 there should be universal health coverage were also not mad. And the United Nations, combining all countries in the world who said that we should have sustainable development goals and we should have universal coverage, were also not mad. Now, this is a broad universal objective, which we are now trying to meet. And in meeting it, we are going to improve our healthcare. If we ever wanted ways of improving our healthcare, this is one of those. And people always focus on some few failing hospitals where there are weaknesses. There are many hospitals in our country that are doing well. And I know that bad news travels fast, and bad news almost always is propagated by you in the media as proving the fact that things are falling apart. But they are not. Our healthcare system now supports 62 million people. And we have a fragmented health system right now. We have a healthcare system for the rich, for people who are very rich. But what's worse is that we also subsidize them. in my newsletter this morning, I've written about it, that we also sacrifice 37 billion rand for those who are on private health care. And we give them rebates. This is money that the state forgoes, that it should be taxing people on. And the system was configured in that way. And now we are correcting that system. And what is worse is that people who are on private health care are always seeing their costs going up continuously. And when they run out of their benefits, they run to the public health care system.
If the public healthcare system works so well, Mr. President, why are you and your cabinet ministers not using it as many as... Because I know there are a few that say they will go to a public hospital.
I don't think that is a measure to even judge. Quite a number of my colleagues, and I haven't been in hospital for a while, quite a number of my colleagues go to Steve Biko Hospital, which is in Pretoria.
Which ones? I can count 2 of the ministers who have publicly
said...
No,
but that is not even a measure. We are talking here about the public. I mean, it's like saying, there are people who send children to their private schools. That is the choice they have. But in the end, once we have universal coverage, yes, they will even be able to go to those private hospitals, but it will now be under the NHI. It will be under a national health insurance. So that is not really a measure to say, this is favoring this one and that one and that one. The real issue here is that there are people who are opposed to universal health care. And we are saying universal health care is going to support all South Africans, including the poor, and including the rich as well, because the rich are also finding it difficult to continue funding their own medical costs. I mean, you ask them. I once asked my dentist, and he said, President, I am struggling because myself and my family now have to pay a lot of money, and now we are going to resort to the public health care, the dentist. So in the end, private health care in South Africa has become so expensive. And if, Clement and CD, if it was not for the subsidies that we give people, it would not be sustainable.
Are we going to get higher taxes?
Well, in the end, I mean, we've got to find a way of funding NHI, and that is still to be determined. And that is why NHI is going to be implemented on a phased basis. Now, people want to use scare tactics and say, yes, they are now going to tax us higher and so forth. And we are saying we should embrace this, all of us, and make sure that the NHI is implemented. I was pleased to see that even some voices in business are saying we want to work with government to make sure that the NHI succeeds.
Join us. Let's walk the talk. This is 702.